this fight, and I'm looking forward to hearing all the presentation today. And once again, thank you all for coming today in the European Parliament for this very important issue that we'll discuss here today. Thank you very much.
Thank you very much. It's really good to hear that we will be have an opportunity and be in a position and committed to making sure that these aspects of fertility education are seen within that context of gender equality. Now let me pass the floor to our other co-host, that's Kirita Hansen from the Green EFA from Denmark.
Thank you very much and good afternoon to everyone. It's a pleasure to be here and I'm very honored also to co-host this event. And thanks also so much to Fertility Europe for establishing it and for the work on FACTS project. I think you're all playing a very crucial role in ensuring that we have equal access to safe and also to fair fertility treatment, and just as importantly that we have information available about reproductive health education. Because as you all know, far too many people are struggling with infertility, and far too many only realize how little they know about fertility when they begin to try and have a child. And most of us learn how to avoid pregnancy, but not how to find a pregnancy. And I think for me, as a politician, it's also important that fertility is not just a private issue, it's also a public issue, and it's not just a medical issue, it's also a social issue. And so I think today's discussions are very important, because despite the progress that we've seen on the national level, on the European level, there is still a very big gap when it comes to fertility awareness across Europe. And studies also show, and I think you've also color-coded it here, the lack of information, especially among young people when it comes to fertility and reproductive health. And I think that's also why the demands from the FACTS initiative is so important, because we want to make sure that we know what are the missing information and also then provide that. Sometimes I get the question, why the EU, why Europe, why not just the national level? I think for me, where I see the added value to EU is that we can ensure recommendations to member states to integrate the issue of fertility as part of the sexuality education in the different educational levels. And we can also use the EU to support programs to help schools develop strong materials to support the educational level. And we can also ensure cross-border exchange on best practices in this issue. And of course, there's the issue of funding, and research, which is also very important. I think there's also an issue about gender equality, especially in times today. This is also important to mention that fertility also had a gendered angle, both for men and for women, so to keep this in mind. But I will also stop here and say that I look very much forward to the discussion today and to kick off the FACTS program. Thank you.
Thank you very much. Again, it's so good to hear that we have people in the European Parliament who see a very holistic aspect to this issue, that fertility is a social issue, it's an equality issue, it's an issue of intergenerational fairness and solidarity, and it's a big issue for European society. I was moderating an event yesterday on AI, and one of my speakers said that every year between now and 2050, Europe loses 1 million workers because they're aging out of the workforce. That's a significant impact for Europe. So, fertility rates, which are dropping across Europe, have this big impact across employment, across society. So thank you for putting that in a bigger context. Now let me pass the floor to Claudia Bodic, who is the chair for Fertility Europe, to give us another welcome.
Thank you. Dear members of the European Parliament, dear colleagues, partners, supporters, friends, it's actually a real pleasure and honor to welcome you here today. First, I want to sincerely thank our hosts, MEP Kira Mali Peter Hansen and MEP Marco Verstega, for your support and dedication to youth well-being and reproductive rights. Well, I speak here today as the Chair of Fertility Europe, the umbrella organization of national patient associations from across Europe and Greenland and beyond. Our common goal, in short, in Fertility Europe is that everyone affected by infertility or involuntary childlessness has access to publicly funded fertility treatments. But today, we're not here to talk about infertility. We are here to talk about something which actually comes earlier. We are here to talk and discuss fertility awareness. Over the years, as patients and also as advocates, we have listened to many personal stories, and one sentence echoes across all of them. If only I knew, or I wish someone had told me sooner. People wish they had known about fertility, how fertility works, what factors affect it, and when it's time to ask maybe for help. It was in 2019, during our European Fertility Week, when we held an event right here in this parliament, this event was fully dedicated to fertility awareness. We presented then real stories of individuals and couples who were trying to conceive at that time, who were facing or having faced infertility. Some of them eventually did become parents through IVF, donation of eggs, sperm, or adoption, but not all of them. Some were left without children, not by choice. Some of them have for sure because they had not known the facts early enough. Many of them told us also they might have started trying to conceive earlier, sought medical help sooner, explored different options. If only they had understood how fertility works, what influences it, and why time is so important. What they were and are still missing is timely, clear, and reliable information. But what really intrigued us in Fertility Europe was, where does this gap in knowledge begin? When do young people learn or not learn about fertility? And how can we as a society, how can we respond? This is why the FACTS project actually was born, standing for Facts and Fertility Awareness. It was developed in collaboration with our partner organization, the European Society of Human Reproduction and Embryology, ASHRE, which recognized very, very early the importance of fertility awareness. FACTS is a collaborative educational initiative developed to better understand what young people know about fertility and reproductive health. We will hear more about it in the following presentations. The FACTS game has been piloted in 4 European countries, and today we are here to share the results of this project and what it means for the future of Europe. We are not here to tell young people when or whether to have children. No, that's not our intention. That is a personal decision. But we are here to make sure that they have the knowledge they need to make informed decisions and informed choices on their own terms and in their own time. And why this matters to you, our policymakers? Because fertility awareness is not just, when we heard that earlier, it's not just a personal issue. It has broader implications for the EU as well. It touches on key policy areas like public health, education, gender equality, and yes, even demography. On behalf of Fertility Europe, I thank you once again for being here, and as we heard, for being our allies. Thank you for that. Your presence signals that this topic is important, and that we can only together make meaningful steps forward towards also for our next generation. So, thank you.
Thank you, Claudia. And it's so interesting to hear sort of where this project came from and its historic roots. We're now going to watch a little video that will tell us a little bit more about it. So, can we press play, please, on the video?
We had a small sound issue, so it's fixed. Okay.
behind that, but apologies if we didn't get that. If you go to myfacts.eu, you'll have a chance to watch that video as well as, of course, take the game and other things. But I think the key points came through. The kinds of questions and the myths and the information are addressed, and you're invited to go and test yourself and see if you can also match the scores of young people who took the tests across Europe. So let's find out a little bit more now about that project. And I'd like to invite Elena Popova, the Vice Chair of Fertility Europe, to come up and to take us through the research aspects of that project. So Elena, please.
Thank you, Tamsin. Dear guests, thank you for joining us today at this event in the European Parliament. I will tell you more about the Fertility Awareness Initiative and its pilot stage. As you already heard, this is a collaborative project between Fertility Europe, the umbrella patient association of European patient organizations in the field of infertility, and the scientific organization ESHRE, the European Society for Human Reproduction and Embryology. Why we decided to focus on fertility awareness? Over the past 50 years, the birth rates have steadily declined in Europe. At the same time, infertility rates have risen. As a result, the issues of fertility and infertility are now in focus of scientists, policymakers, NGOs, and other stakeholders, and just some alarming statistics. The average total fertility rate in the EU in 2023 was 1.38 births per woman, and this is the lowest average recorded in Europe since 2004. Well, at the same time, the average age of mothers at first birth is approaching 30 years. Approximately 1 in 5 people in Europe face infertility. So Fertility Europe and ESHRE are profoundly concerned and determined to take action. Our goal was to assess the level of fertility awareness among European teenagers and to highlight the need for improved fertility education and to propose as well effective solutions to increase this level of awareness. Why fertility awareness? We see this as a level of knowledge and understanding about the human reproductive system and fertility life cycle, including potential risks to reproductive health and the ways to safeguard it through different life stages. Why do we focus on fertility? Fertility awareness enables informed choices and decisions later in life, thus reducing the risks for infertility. Increasing fertility awareness can help to identify early the issues, which leads to timely interventions and reduces infertility rates. Preventative fertility education can also reduce the long-term costs, healthcare costs associated with costly infertility treatments. Fertility awareness also promotes gender equality because both men and women can make shared fertility decisions supporting family planning. Why did we choose the teenagers? We believe that teenagers are at a critical stage of their development when physiological changes and social influences can have a long-lasting effect on their health and their behavior. Educating teens about fertility during this period can allow them to make informed decisions later in life. We also believe that rising fertility awareness early can help prevent future issues related to infertility, as teens will have a better understanding of how they can harm their reproductive health by their lifestyle choices. And by targeting the teens, we ensure that the next generation will be better equipped to handle their reproductive health. So now let's briefly describe our project. The objective: to gather and provide reliable information on the level of fertility awareness and to try to rise the level of fertility awareness among European teens. The age group we have selected is 15 to 18 years old, and we have worked with 5 pilot